Hi, everyone. Welcome to Getting to Know Menopause. This is a program that is really going to help you understand what is going on in your body, whether we see you for care or you go outside of our clinic. But it's going to really help you understand what is menopause, what are the different symptoms of menopause, what are the various symptoms that are going on, and any kind of myths and misconceptions. We want to empower you with the knowledge you need to navigate this during this midlife transition and beyond. So let's get started and let's dive in. So when we look at the global perspective, there's going to be about 6,000 women per day that enter menopause, with about 2 million people annually. By 2030, we expect that there's going to be over 2 billion women in menopause, which is absolutely staggering. 60% feel completely unprepared to actually talk about their symptoms and what happens. And I think it's also important is that we talk about this 75% rule. 75% of women are symptomatic. 75% of women seek counseling for hormone therapy, but they don't get the care that they need. And 75% have symptoms that disrupt their lives and their ability to function, especially during the perimenopause timeframe. So what is menopause? Menopause is a time frame in your life. It's on average around age 51 and a half, and it is the final menstrual period. It's the cessation of that final menstrual period and 1 full year that you've gone without a period. It's defined as all periods kind of stopping, and it's recognized to have occurred 1 year after. So if you go 300 days and then you get a period again, that's not a true definition of menopause. And there are some labs, and we're going to talk about that throughout this program, what that may look like to kind of help you understand what transition you're going through during your phase of life. So let's kind of talk a little bit about this. 88% of women underestimate how early the menopause symptoms can strike. In general, Black women experience the symptoms much worse during this menopause, and the longest duration of time on average could be about 10 years. For most, it's probably somewhere in that 5 to 7 year time frame, and the average age is right around that 44 to 45. But I want people to just understand that they could see these symptoms several years prior than that time frame, just so that you feel validated and that you're being heard, that you're not alone. And if you're not feeling like yourself, which a lot of patients tell me, I want you to be able to advocate. So in terms of the different review of terms, we have the perimenopause, the menopause, and the postmenopause. Perimenopause is that initial time frame before the menopause. It's the time frame where it's the most chaotic. It's kind of that, as we like to quote Dr. Mary Claire Haber, that zone of chaos. So much is going on in your body. Estrogen is plummeting. Estrogen acts very much like an anti-inflammatory hormone, and it's that time frame where women come to me telling me they don't feel like themselves. Menopause, again, is that cessation of the period for 1 full year. The true menopause basically lasts for that year that you're kind of going through that, but it's those years of perimenopause. And then menopause is really kind of that one day where it's like, okay, periods have stopped for a year, I'm now menopause. And then the next day you're technically postmenopause, which is all those chapters thereafter. And we're going to dig into all these signs and symptoms. So what actually is menopause? It's a syndrome of hormone deficiency. It's also a syndrome of many other deficiencies that can happen. And usually what I tell people is that it lasts until death. That's kind of that postmenopause time frame. And it can be associated with a myriad of other conditions: iron deficiencies, hypertension, dyslipidemia, cholesterol changes that my patients say, I never had cholesterol issues until I went into this midlife time frame. Obesity, osteoporosis, thyroid deficiency, those are all pretty common that we see and that can happen. In terms of menopause terms, I want you to understand this a little bit better. There's natural, early, and premature menopause. That natural menopause is going to be on average around that age of 51 and a half, and it's that loss of ovarian function. It's a normal loss. It happens as our ovaries just begin to shut down. When we go into these earlier menopause timeframes, that's going to be the onset of menopause that happens between 40 and 45. And so that's going to be that patients go into it a little bit sooner, and that's really where hormone care is really, really important to discuss either with me if you're one of my patients, or I'm going to help you navigate how to talk about that with a clinician if I don't see you in an area where I'm licensed. And then there's premature menopause, or sometimes we will call it premature ovarian insufficiency at times, where the onset happens before the age of 40. And again, that's where hormone care can become a very important conversation. If a patient chooses not to use hormone therapy, that's fine, but I believe that every woman deserves to have this conversation. The other types of menopause also are surgical menopause and medically induced, or that happen due to treatment. So that surgical is that loss of ovaries because either you've had your ovaries taken out or that they've been removed for whatever reason. And then medically induced can be things such as cancers or things like that as well. All right, so perimenopause, I think it's a great way to say these ovaries are going out of business. They're not working. And so that can cause some drastic fluctuations for people. And it can start in those early 30s. Irregular periods, sleep disruptions, mood changes, not feeling like yourself. Late perimenopause is often defined when the periods start really spacing out more. I define it as early and late perimenopause. Early is going to be where you may have about a 7-day fluctuation from the beginning of one period to the beginning of the next. So normally you may have been a 28-day cycle. Maybe they're coming a little bit sooner or a little more or a little spaced out with that 7-day duration. Usually in that late perimenopause time frame, though, those periods are going to be about 60 days in duration, where they're going 60 days or more. Usually that lasts on average for about 1 to 3 years, but it definitely can be more so for others. Pregnancy can still occur in this perimenopause timeframe. So even if your cycles are 60 days apart, it's really important that you understand that this is a time that you could potentially get pregnant. And yes, here's that answer. 1 year with no period is that end of fertility. So I think it's just really important to make sure that you're having those conversations and looking at options if you need to use birth control. If you are needing to use birth control, there are many different options. You still can use oral contraceptives, and you deserve to have a conversation around oral contraceptives because they can help some perimenopausal symptoms and into menopause. It's not always my first line option, but it is available. There's also vaginal rings, patches, shots, implants, coils, IUD, lots of different options. And these are discussions that you should have either with me as your clinician or your clinician where we help you get care in your state. In terms of postmenopause, every day after the loss of ovarian function, that's either going to be surgical, natural, or medical treatment. So that's that last part of the chapter where you're going to hit in life, where you stop having periods on average right around that 51 or so, but some people it could be later. That's those postmenopausal years, and we'll dive into that more as well too. So what if you still have your ovaries, but your periods are going on? Or your periods are not there? So what does that look like? Again, it's going to be based on a clinical diagnosis. And that's where you heard me mention real briefly about labs. A lot of times we'll get an FSH level. That's that follicle stimulating hormone. It's a hormone that's produced in our pituitary, and it talks to our ovaries, and it elevates when your estrogen is just not being made in those ovaries. So usually you'll see in these patients that are still in this transition is maybe the FSH is a little bit elevated, or maybe the estradiol is low. In terms of your symptoms during this time frame, hot flashes, this is going to be the most common symptom, and it's present in about 80% of women. You also may see some vaginal dryness, and this symptom is present in about 40% of women. In terms of sleep disturbances, this symptom is in about 46% of women. And then a lot of women will talk about maybe this new onset of depression. Women in menopause are 2.5 times more likely to be depressed during this time frame. In terms of the most common symptoms, I like to kind of put those on here because what it talks about is the 20 most common symptoms: hot flashes, night sweats, brain fog, low libido, low mood and depression, and joint pain. They may be tired, or they may have some low energy, difficulty sleep. You can see there's several different symptoms that they can experience. Okay, so let's continue on with these usual but not uncommon symptoms that we can sometimes see during this time frame. So those may be things such as dry eyes, dry mouth, burning tongue syndrome, gum soreness, electric shocks, shortness of breath. There are so many different symptoms that can happen in this perimenopause and menopause transition. And I just want patients to feel validated and people to understand that if you're feeling a certain way or you're feeling that things are going on, I want you to feel validated to understand that you're not alone and that your symptoms deserve to have a discussion with a healthcare provider. All right, so I want to kind of debunk some of the myths and misconceptions. A lot of times people will hear you're too young for menopause or that hormone therapy should only be used as a last resort. Symptoms don't last so long, so maybe you just need to suck it up. Menopause is just a year. All the symptoms may go away. These are all things that a lot of patients have heard, and I just want to unbunk them and say, I'm glad you're here. Thank you for taking the time to do this program, and we want to help you navigate so that you can be your best self. So I think it's really important to understand why it's so hard to find good menopause care. In 2017, a survey was sent out to residents across the country, and it found that 20% of them had not even heard a single lecture on the topic of menopause. And a third said that they would not feel comfortable prescribing hormone therapy to a symptomatic woman, even if she had, especially if she didn't have any clear conditions, and they felt that it was an elevated risk to do so. 71 reported 2 or fewer lectures on it, and about half of practicing gynecologists are under 50, which it means that they started their residency after the publication of the Women's Health Initiative, or the WHI, that really changed how we prescribe hormone care and actually did a lot of disservice to women. So they may have never received actually meaningful education on menopause or how to treat patients. So there has to be conversations around the risks and benefits of these treatments, and they often require more time than just that usual 15-minute slot. And insurance often only reimburses for just a routine medical visit. So it doesn't mean it can't happen in an insurance-based model, but there's less time for it to happen. And it really needs to be nuanced care and shared decision-making. So I think having a program such as this is really helpful because patients can have access to it before they go see a clinician and arm themselves with questions and things on how to navigate this time frame. The other issue that we have is that there's been a lot of secrecy, shame, and stigma around sexism, ageism, and racism. And I think that that is also really important. I think we're doing better jobs about having women feel seen and heard and navigating this time frame, but there is still a lot of sexism that goes that they're just dismissed because they're told they're hysterical or that they need an antidepressant or they're told it's a normal part of aging. And again, there's racism that comes with it too. So I just want you armed that this knowledge is so powerful. This information is so important. Every woman deserves this discussion, and we'll go ahead and see you in the next series on your body in menopause.